Have you ever eaten just straight salt? Well, if you have, I bet you could tell me that it doesn't taste very good. Well, imagine being on one of your worst days and you feel like it was pretty normal, except you start to feel really groggy, really tired, out of control of your body. Your heart starts to rush. You're sitting and your heart rate was just 52, but now it's rose all the way to 153. Well, that's when you're going to have to eat this handful of salt. But wait, your mouth is contracted. Your eyes have rolled back. You can't eat that salt. You have to look for somebody else to help, which is the case for many POTS patients. POTS is a long-term side effect from COVID, along with epilepsy and sleep apnea, and many others. 5 years ago, when COVID first happened, we didn't know if it was just going to be short-term effects or if there was going to be long-term effects on the patients that were diagnosed with COVID. Now studies have shown that there are many long-term effects, with POTS being one. POTS by Cleveland Clinic is postural orthostatic tachycardia syndrome, which is basically just a uprise and a decrease in blood pressure when it's beating too fast, when it shouldn't. When you're sitting down and your heart rate was just 53, but now it jumped up to 153 for no reason. It can come from position change, talking, standing too long. Heck, it can even come from eating. POTS does not go away once it develops. It can get worse and it can get better. But before it gets better, it gets way worse. You lose complete control of your body most of the time when you have POTS. Your heart starts to race, you get sweaty, but you feel so cold. You feel so cold, you start to shiver, your hands contract in on themselves. You wouldn't want that for yourself. And neither did half these patients that had COVID. Most of these POTS diagnoses came from mild cases of COVID, not even severe. Most of these people just felt like they had the flu or the cold, and now they're stuck with POTS? Pretty unfair. POTS has many different things. It's not just passing out or feeling faint. It's dizziness, brain fog, gastrointestinal issues, sleep issues, shortness of breath, and many more. It can also lead to depression and anxiety because these POTS patients feel like they don't have control over their own bodies and that everything else is going around them without them improving or getting better. With anxiety and depression, it can make POTS way worse because if you're worrying about something constantly, your heart and your brain doesn't regulate that good enough. So that increases your heart rate, making your POTS episodes more frequent and more long and worse than they were. There's no cure for POTS. This is why depression and anxiety come from it. You can treat it with medicine such as fludrocortisone or other different blood pressure monitoring medicines. Some will be put on heart monitors, but a lot of it doesn't show much. You can also be put on a diet, but it takes a long time for a diet to even start to help a little bit. You can also do exercise, but some POTS cases increase and get worse with exercise. So really, all POTS patients are at a standstill with how to treat their POTS. It's really not treating, it's regulating. You have to listen to your body and learn how to adapt in situations. You have to ask for help. When many people are independent and they don't want to ask for help, they have to when they have POTS, or else they won't make it. They won't make it mentally. They need a support system around them. And that's why it's important to know and acknowledge yourself about POTS, because somebody you know, somebody you could work with, somebody you could go to school with could have POTS. And yet you could help them by being there for them mentally and physically. If they have syncope or pre-syncope episodes, you can help by encouraging them, by talking to them, asking them what they need, because a lot of the time they will vocalize it before the attack even starts. COVID has created an increased uprise in this. American Family Physicians said 10 to 30% of COVID cases now end up with a POTS diagnosis in the end, which is making it more widespread, which also, again, helps if you know how to help your friends, your coworkers, even a stranger in a store, in an aisle where you see that they're not at their best. It could help. POTS is overwhelming for all, but it's even more overwhelming for the patient that's diagnosed with it. So if you could help, that would be great. In conclusion, I've explained how POTS works, what POTS is, the cure for POTS, alongside as ways to help, and how COVID has created an uprise in POTS cases. If you could take a minute of your time and reflect back on this video and think, have I seen somebody that may have POTS? Or how can I help somebody with POTS in the future? That'd be great. It would help many people, and it could educate yourself further on more activities. Thank you.